Hello and welcome to Gateways to Healing. I'm Scott McGuffey, clinical hypnotherapist and your host. Gateways to Healing is a program that is designed to help you utilize complementary medicine with Western medical services. This is an 8-program series where we look at the introduction, exploration, and also how to explain how to use complementary medicine with Western medical services. The 4 gateways of healing are the mind, the body, the spirit, and the community. Today I'm really excited because we're going to talk about the mind, and that's my area of specialty as a clinical hypnotherapist. The mind is a beautiful thing that can really facilitate the self-healing potential that we all have. To give you a little bit more information about myself, I am a clinical hypnotherapist and a member of Integrated Healing Arts. I have a private practice in Palo Alto, and I also work with the San Mateo County AIDS Project. I also teach self-hypnosis and guided imagery and a wonderful class on weight reduction and optimal health. I'm also really excited today because of my 2 guests, and I'd like to introduce them now. On my right is Dr. Nick Zerpolo. He is a founding member of Integrated Healing Arts, a licensed psychologist with a specialty in medical psychology and the mind-body healing, a former teacher of centering and awareness techniques, and he has over 30 years experience working with his own physical disability and chronic pain.
Hi, Scott.
Hi, Nick.
Good to be here.
Pleasure. And we also have Mr. Jim Charlton, who is back with us, a meditation instructor, who is also a founding member of Integrated Healing Arts Group, the co-founder of Pathways to Self-Healing. He teaches skillful living principles to individuals and groups. He has studied meditation techniques in the United States and Burma. Jim has been teaching and studying effective living techniques for over 30 years. Well, I think we'll just jump right into it. And our first topic is, the gateways of the mind can be a very useful technique to facilitate the self-healing process. Mr. Charlton, how have some of your clients utilized mind energy for their own self-healing?
Well, Scott, my students quite often come to me through meditation practice. They're having some difficulty with their thinking process. What I try to teach them is that they have thoughts, and they have a mind, and to become observant of it, but not be it. So by that way, they can identify what kind of thinking patterns they have, and have little respect for them.
Well, how do you go about doing that? How do you show them their thinking patterns through meditation? How does that work?
What we do is we get them quiet, usually sitting on a chair, and close their eyes, and to just become aware of whatever arises first. Now, sometimes we put their attention on the breath, just as a way to anchor the mind. And then we let the mind do what it does. And after a few moments or minutes, the person will typically start thinking about something that usually they're anxious about. And then by identifying that thought, by just saying thinking and coming back to the breath, they develop a very high awareness of their thinking process. And then by seeing that without any other intervention, that thought process has a little effect on them.
So through the process of meditation, the awareness actually works with the body then?
It does. Because as we all know, that what we think has a powerful effect on our bodies.
Yeah, either positive or negative.
Absolutely.
Yeah, okay,
so,
great. Dr. Zerpolo, you're a licensed psychologist and probably the most pristine of the 2 of us here out of Jim and myself, but you do things in a little bit more unique way with your clients. How have some of your clients come into their mind energy and their self-healing?
Well, they actually don't have the kind of preparation that many of Jim's clients would, who already recognize something about themselves and want to be in a meditation setting or practice. Very often my clients come from physicians or surgeons who will send them to me for help with chronic pain or with preparation for or coping with the aftermath of something difficult like surgery.
And what are some of the techniques that you use to open up their awareness of that mind gateway?
Well, I first off allow them to express whatever their concerns are and want to validate those and make sure that they know that I realize too that those concerns are important ways that they're taking care of themselves. They're new in the situation, they haven't had such a surgery before, and they want to do something about it. For example, I'm working with a woman now who needs a lot of information in order to feel comfortable and a good sense of control over things. Her surgeon is not always the most verbally communicative person, and that's not what surgeons are trained to be. So I encourage her to be as verbal with him as she can and to outline what her questions are, and also to bring those up to me. At the same time, and so to get as much information as she can. And at the same time to recognize that the relationship she has with her surgeon is really important. And I bring up some other information for her mind to use, that people who have good trust in their surgeons have smaller scars, quicker recovery times, they need less pain medication, that's well established. And usually an individual patient isn't going to know that information.
So what we're talking about here as we talk to the audience out there is that as we use complementary medicine with Western medicine, this is a perfect example of that, wouldn't you say?
Absolutely.
So we can have a person who becomes aware of their mind energy, and then they can use it with the Western medicine.
Quite
often. Great. One of the fascinating aspects of the mind is its ability to solve problems, and I think that's kind of what we're leading to right now. And those problems could be either psychological, physiological, or emotional. And one of the things I found in my practice is that by entering into the gateway of the mind, there's a certain experience of release that my clients have. And with that comes the freedom and the awareness. I think that's what you were both talking about, as this awareness comes into play. And Nick, let me just ask you, what are some of the ways that you guide individuals to their freedom and awareness?
Well, for example, many people bring up, or come in with, I should say, anxiety or possibly even depression. And let's say it's about a medical issue, that they're working with their physician about the physical part of it in a certain degree. And what I might ask them to do is to be aware of how their body feels at a given moment, whether they feel tense or relaxed. And usually there's some tension, or with depression there may be a feeling of heaviness. Then I ask them to change that feeling just a few percent, maybe 10%. Once they do that, they get the experience that they have some control over how they feel. So empowering them to have more control is a really important part.
So it sounds like what you're also leading here is that we all have the ability of self-healing. And I would have to say that the experience I've had with my clients is that that awareness alone is very small. And by entering the gateway of the mind, that awareness grows, if nothing else, that they can talk to their surgeons and talk to us, and there is a relationship there in the rapport. Jim, let me ask you, as we talk about the relationship between the people, the clients that we work with, and how they work with the relationship of Western doctors, of its traditional physicians and things like that. Where is it useful with meditation to open up that communication, to gain that rapport?
Well, Scott, I teach a lot of chronic pain and stress workshops. And in that process, by making people aware of their conversation and their awareness of their sensations and becoming friendly with those sensations and not fighting against them, that it makes a profound effect. Quite often what happens is that people have pain and they resist the pain, though the muscles around the pain tense up and really amplify the experience of being in pain. So if we can make them friendly with that and curious about the process that is happening to them, they might still have the same amount of original pain, but the added pain, the added suffering gets diminished. It's very powerful. We've had people with multiple back surgeries and come back to a normal life.
So the whole process then for the individual, as they work on healing, their own self-healing with the practitioners, then they actually have some control and a choice, really, right? Is that what you're saying?
So that the medical doctor helps them, that their own process helps them, that they're less resistive of what's happening in their lives. And that's where suffering occurs, is when people resist what's happening.
That's a good point that you bring up about suffering, and I know, Nick, you just acknowledged that as well. You work with a lot of people that come in with suffering. And so how do you approach that?
Well, first I ask them to tell me what their suffering is like. And let them know that it's valid to have that they have been going through that, and that experience counts. That has meaning to them, and it's real. And often people are concerned that if their physician has sent them to a psychologist for help with pain, maybe that means the physician thinks it's all in their mind. So they're very concerned about that. So I need to make clear to them that I don't have that belief at all, that they have a physical injury that we know about, we've seen it on MRI, whatever it might be. They have objective cause for the pain and discomfort they feel. They also have objective cause for the depression or anxiety they may feel. Perhaps they're out of work because of this injury. They have less income. These are real factors. So first to say all these things are valid, and then to say we can do some things about this.
Yeah, and I think that's a good point. When we were talking earlier last week, one of the points that you brought up was that all illness is not necessarily bad, that it does have its benefits. And I think we in the mind field experience that much more than a physical doctor. Well, what are some of the benefits then with an illness?
Well, it changes the way the mind works automatically. Each of us has a certain personality or style with our minds and the way we deal with the world. And when we have an illness, it usually disrupts that. So we have to become more flexible, kind of whether we like it or not. And by that, we grow some. Just as having children can be a very growing and stretching experience because we're not prepared for all that. And we're not going to do perfectly at each of the things that occur, and some parts may be difficult. But it allows us to grow. It gives us a stimulus to grow. In some ways, the way a grain of sand can be an irritating stimulus to an oyster to grow a pearl around.
Exactly.
Absolutely.
And that's one of the things that I work with my clients a lot. Matter of fact, I had a woman I was working with today who had just gone through a tremendous change. And she was working with a drug addiction. She went through a program. And here's the interesting thing. She successfully completed the drug program. And she's been clean and sober for 8 months. And she felt very excited about life, but she didn't know in which direction to turn. She didn't know where to put the excitement, because it was that change, and this illness suddenly made her realize that there was something more available to her. And so through the process of hypnosis, we were able to use the mind to open up the map of the mind, or the web of the mind, and I want to get to that in a little bit, because I know you two are very good with that. And we were able to shine some light on that, and she suddenly realized that what she always wanted to do was cook. And now she had some place to put her excitement, and that had come through that. And she never would have thought of that, perhaps, without that change I believe you're talking about.
Let me cue off your example about that and talk about a young man that a surgeon sent to me. He had already had one surgery on his right hand. He was injured in an industrial accident. And the hand wasn't doing very well. It was kind of limp, didn't have much power. And he certainly couldn't go back to work that way. And the surgeon had him on pain medication, but said to me that before he would do the second surgery, which was required, he wanted him to be free of the pain medication. And so I did use hypnosis and a variety of techniques with him, but for this particular fellow, none of those was able to engage him appropriately. And I said to him at the end of our first session that I would like him to go home and make a drawing of his pain. And he looked at me like I had two heads. What does this have to do with anything? And I said to him, I don't know if you'll draw your hand, or lightning and thunder, or black clouds, or I have no idea, monsters, Tyrannosaurus, I don't know. And what he came back in with the following week was the hand drawing that you can see now. And as you can tell, it really does dramatically portray what it feels like to have his hand in pain. Now, I found a few interesting things about this drawing and the process he went through. First off, many people, as you may know, a hand is a very difficult thing to draw. And as you can see in the detail, he was excellent at capturing the knuckles, the little curve of each joint between each knuckle where it curves down, the little lines at each wrinkle of the hand and thumb, the fingernails and the moons on the fingernails, plus the pain itself. Now, as you can see, this is his right hand, the injured hand. He was a right-handed fellow. He did this drawing with his left hand. He had never had any art lessons. And the kicker for me was, while he was concentrating on this drawing, he had no pain.
Yeah.
So I was enormously impressed and asked him if I could show this to other people, and he consented. Because of this, it turned out later that the second surgery was not successful in restoring full function. He couldn't go back to the previous job, but he did develop a career as a draftsman and graphic artist as a result of that, just like your client did about her cooking. So often our clients are really amazing to us. We don't know in advance what's going to happen.
And I find, I'm sure, Jim, you have the same thing. I oftentimes find when I'm guiding people through the process of awareness, I don't know which direction they're going to go, which choice they're going to make, other than they have that that ability to make a choice.
It is amazing how if the mind becomes quiet and peaceful, what wisdom there is within each one of us.
Mm-hmm. Well, let's talk about a little bit about the mind itself. Now, we don't know a lot about the mind energy, but perhaps, Jim, you could address that. And just what is the mind energy? I mean, oftentimes when I have clients, they go, oh, you mean the mind, which is the organ of the brain.
Well, when I think about it, I think of a kind of distributed intelligence all through the body. The most prominent part is in your feels like it's in your skull, at least. And the brain is so close to the master glands that regulate the body. It's truly astounding that a thought can actually race your heart, can interfere with your digestion, that can raise your blood pressure, can change your circulation. I mean, and we know these things are true because we've done it in biofeedback. We've had yogis come over from India and demonstrate even fibrillating the heart consciously. So it's pretty astounding. So that's why when Nick talks about preparing his clients for surgery, one of the things that I'm sure he does is to minimize bleeding. And by putting that suggestion in the mind actually can. And I've had that experience with people going into surgery who come back and the surgeons comment on how little bleeding there was. So the power of the mind is astounding. And we all know this.
Yeah, excellent. One of the things that I also wanted to bring up was what comes from entering the gateway of the mind, and I believe that really has to do with awareness and perception. Now, as I listen to you two, I'm kind of realizing that maybe Jim and I, we take from the moment and go forward, and Nick, you go back a bit, and even in regression work and hypnosis, there's a little bit of that. But the image that often comes up is this mind is a map, or it's a web, and how we travel within that. And, well, let me just jump back to Jim here. In meditation, that web is a beautiful place to explore. What are some of the things that your people, your students, end up discovering?
Well, one of the most profound things that most of them discover is that they're not alone, that they're an integral part of the universe. And it's not just some mystical nonsense. It's an actual experience, plus hard science now backs that up. We're all energetic beings. So we can't, all three of us, or all these people in this studio, we can't not affect each other. And so our environment affects us, the way we act affects us, whether we're loving and kind affects others, and it ripples out through the world.
So that would be more like what we hear nowadays as the global consciousness.
Absolutely.
Yeah, and we're all a part of that.
Yeah, and it's kind of a miracle, because even the food on your plate is generations of farmers, thousands of people, and if this web comes together and it creates us, for a brief time.
One of the other things I wanted to address here is the mind-body connection with Western medicine. Now, there seems to be, at least in America, a pretty standard split between that. You know, the American physicians, they do their thing, and then, you know, we as mind practitioners, we do our thing. But I believe that there's now becoming more of a closer contact and relationship with that. And actually today, more and more people are seeking out the mind-body connection through the process of healing, which we touched on a little bit earlier. And I'd just like to know, Dr. Zerpolo, how you see that shaping and forming in the future. How do you see people utilizing the gateway of the mind with that Western medicine?
Well, I think it's increasing their understanding of what their own capacity is. And I don't think that we yet have enough information, perhaps, or more than information, kind of comprehension to say what it all is and what it will lead us to. And there's a very old story about this called The Elephant in the Dark that I think is a very nice illustration about that. You can see here we have an elephant surrounded by the dark, and the story goes that an elephant is in a tent in the dark, and a number of local notable people are brought in to find out what is this new phenomenon. And when they come out, they're interviewed, and one says, I felt it and it was like a fan. And another one says, no, it was like a rope. And the third one says, no, it was like a pillar, I could feel it. Another one says, it was a huge wall. Another one says, it was like a big hose. Well, these are all parts, and these are different approaches to perceiving what is in reality. So Western medicine has certain very important things, and that's, if you break a bone, that's probably where you want to go. You know, is to see the surgeon about that, no doubt about it. But Oriental medicine has different understandings about energies that flow in the body that are accessed through acupuncture and acupressure. And we have a kind of bridge that we all do, the three of us, in terms of the mind's connection to the various parts and how the mind is a web of attention that allows us to navigate and move.
I would certainly say that that's my experience with hypnosis. I mean, I probably work more on exploring that road and opening up the headlights so you can see the whole elephant, or you can at least know that there's a whole elephant that exists, and you can then choose what you'd like to focus on, you know, whether it be the foot or the trunk or the ear.
Yeah, as Nick was saying, the thing that we have to keep in mind is that it's all an interactive system, that the mind, the body, the spirit, and the society all interact. So you can't treat one piece of a person. You really do have to take a global look.
Well, let me ask you this. What would you suggest to someone who was, say, dealing with either chronic pain or maybe preparing for a major surgery, and let's say for the first time they see this program? What would you suggest to them? How would they approach the mind-body connection and that healing process?
Well, I think first they can tune into themselves. And that may be sort of code words. Maybe I should say a little more about that. That means to extend their attention into their bodies and feel whatever they can feel. Clearly they're feeling pain, they're feeling discomfort, they're feeling probably some kind of, they have their posture a little out of whack to kind of compensate for the pain. And they're probably feeling some emotional effects along with this, which show up in the body feeling as perhaps heaviness or rigidity to protect against something that might happen. And as they do that, to just hold whatever those sensations are that come to their mind in their awareness and breathe at the same time. And when I say breathe, I don't mean, of course, we're always breathing all the time, but we know that someone who's panicky is breathing way up here, and their breaths are very short. And we want the opposite of that. We want them to have a deep breath, not lots of air, but deep down to the abdomen. And often people can't find their abdomen in their minds because they're not used to that. So I suggest put the fingers on the abdomen and let the abdomen push the fingers. The abdomen is active, the fingers are passive. And that's the beginning of change. And the reason that works so well, we can explain in Western terms, that that sort of breathing is controlled at the base of the brain. Worries and anxiety and so forth run across the cortex. So when we get to a more basic layer of the brain, we become calmer and more in tune with our physical needs.
Yeah, I know I've certainly used breath in my practice. And Jim, you probably have a similar experience with meditation.
Belly breathing is really powerful. It's a great anchor. And then when we do stress reduction classes, that's the technique that Nick is describing, is the first one we teach people. And it is amazing, especially with women, that it's not culturally correct to have an extended belly.
Hold your stomach in, sure.
So I've had women, it's taken me a month to get them to actually move their abdomen. So, and with a great relief that comes with it.
So as we talk about the mind and the mind-body connection, I think that there's a lot of things that work with Western medicine, and a lot of things that are popping up are like pain management, stress management, pre- and post-op surgery. But what about the emotional side?
Well, I think that's a really important issue, and I think there are a couple of useful ways to explain what are emotions and what are we supposed to do with them. One perspective tells us that emotions are one wavelength, one bandwidth of perception. We have mental perception, we have physical perception, sensation, and emotions are another kind of radar. You go into a room where there's a bunch of people, you feel, is this going to feel comfortable or uncomfortable? That's good information. That's pro-survival, so we have that. Another understanding of emotion is, an emotion is a thought experienced in the body, which is kind of, oh, okay, I feel a little down about that. This is a pain in the neck. What are we talking about? Pain in the butt. Oh, that's low back pain. It broke my heart. Our language really tells us what we're experiencing physically. It portrays it directly. So emotions are really important. They're important to have.
Do you suppose they're primitive, more primitive than thinking?
Certainly. We can tell that animals manifest what is analogous to our emotions, fight, flight, fear, rage, but they're not cognitive. As far as we know, they're not having thoughts. They're not telling us about it. So it's important not to try to suppress emotion. There's some Western notion from science point of view that emotions are intangible, so we don't know what to do with them, but they're really important.
Okay, very good. We're coming very close to the end of our program here, and I think we've opened up a lot of interesting things here with the mind and the mind-body connection, and how people may perhaps explore it through meditation, or maybe through some counseling if they're getting ready to go into surgery, or through pain management, or maybe life enhancement, life improvement. I mean, that's a lot of what I do with my hypnosis. At this point, I'd just like to say thank you. It's been certainly a pleasure to have Jim Charlton back with us again and his words of wisdom, and Dr. Nick Zerpolo with his wonderful ideas and refreshing discourse on the mind-body connection. I'm Scott McGuffey, clinical hypnotherapist and your host, and I want to thank you for joining us today on Gateways to Healing the Mind. The next time we'll be exploring the body, and I hope you join us then. Until then, here's to your health.